Good afternoon, everyone. Welcome. We'll get started in 1 second. All right. Oh, come on in. Come on in. Thank you so much. All right. Good afternoon. Thank you for joining us for our Planning for Care webinar series, our legal and financial series for the springtime. Today's session is entitled Understanding Long-Term Care Insurance and How to Use It. I am your moderator, Amira Bilal, Vice President of Programs and Policy for Caregiver Action Network. In today's session, we would like to impart upon you how to source and implement long-term care insurance, how to maximize the benefits of your long-term care policy, and then also to look out for what common types of challenges arise in accessing your long-term care benefits. It's my pleasure to introduce our speakers for today. First being Mr. Andrew Kantor. He's senior partner at Kantor and Kantor LLP, one of the nation's leading law firms representing individuals whose disability, life, and health insurance claims have been wrongfully denied. With a career rooted in compassion and advocacy, Andrew has dedicated his practice to helping people secure the benefits they deserve, particularly those living with chronic, invisible, or mental health conditions. Welcome, Andrew.
Thank you.
You're welcome. Our other panelist today is Mr. Marvell Adams Jr., our CEO of the Caregiver Action Network. Marvell brings over 20 years of experience serving caregivers and older adults. He has held leadership roles, including CEO of a large life plan community and Chief Operating Officer within the Kindle system. Marvell is a skilled dementia care coach and a passionate advocate for diversity, equity, and inclusion and accessibility in caregiving. He has earned numerous recognitions, including New York Leading Age Administrator of the Year and 40 Under 40. Marvell also serves on boards like Leading Age and Pioneer Network. He lives in Baltimore with his spouse and his children. Welcome, Marvell.
Thanks so much, Mayor.
Yes. I myself bring over 20 years of aging and caregiving and equity experience from the community engagement arena, and I look forward to moderating this discussion today. So let's get started. First things first, Caregiver Action Network is the nation's leading family caregiver organization, working to improve quality of life for tens of millions of family caregivers. We currently tally this number at 63 million Americans who are providing care for their loved ones. These family members can care for loved ones with chronic conditions, disabilities, or diseases. Caregiver Action Network also supports those meeting the living needs of older adults. We do this by creating resourceful caregivers, creating respect for family caregivers, seeking to reduce caregiver stress, and creating capable caregivers. I would now like to give the floor to Andrew. Andrew, could you share with us some of your views and the importance on long-term care insurance?
Yeah, absolutely. So for many years, my family has specialized in fighting wrongful insurance denials, health insurance, life insurance, and health insurance. And over the last few years, we've moved to long-term care. Because one of the reasons we've moved to long-term care insurance and handling those claims is because we see how important the insurance is and how devastating the denials can be, especially when financially so many people have their financial lives set up so that they need the long-term care insurance to pay in order to be able to support their family or support themselves. long-term care insurance can be so unbelievably important, but also so unbelievably complicated. I find one of the greatest unfairnesses in the world, in my world, is how complicated insurance can be and how simple it should be in order for people to access it, and how wide that gap in understanding can be. I mean, it took me as an attorney years to fully understand how these policies work. And I do my best to convey that information to people. And it's hard enough when things are smooth sailing, when they're just paying the claim automatically, when the benefits are clearly deserved, and even when the benefits are clearly deserved. When it's not smooth sailing and these insurance companies push back, it can be, you're already in such a vulnerable position in your life, be caregiving someone or giving someone care and relying on these financial benefits. And then when it goes wrong, it can be just awful. So we're here to talk about long-term care insurance, what it is, give you a chance to understand it, and talk a little bit about what can go wrong, how to prevent that, and how to kind of arm yourself with information in order to better navigate the entire process.
Thank you very much. So if you could just give our listeners some background on why a person would purchase long-term care insurance and what it's intended to cover.
Sure. So most people get long-term care insurance one of two, or have gotten it one of two ways. The main way is purchasing it through a broker, just a traditional insurance broker, buying it the same way you might go out and buy life insurance as a financial planning tool. For many decades, financial planners across the country were advising people, and rightfully so, to purchase this insurance. The premiums traditionally were relatively low, and the insurance would be purchased when someone's usually in their 30s, 40s, or 50s, sometimes even 60s, to say, hey, if something ever goes wrong to the point where you need caregiving, this insurance will pay for it. Now, it's important because it does not pay for things that it pays for things that health insurance and often Medicare will not cover. And if Medicare does cover it, it covers it to a much lower limit and much lower services. So basically, what long-term care insurance is a financial tool to pay you for caregiving benefits, to pay either sometimes a family member or a professional caregiver to give you the care you need in either at home, a nursing home, or
Okay.
an assisted living facility.
Okay. Now, Marvell, can I ask you, in your experience as a nursing home administrator, what would you think the impact is of a client having long-term care insurance versus not having long-term care insurance?
Yeah, that's a really good question, Amira. In working in senior living for a couple decades, we saw some themes. One was that people came to us with very little knowledge of the tools that were available to them, and long-term care insurance was certainly one of those. The entry point, particularly when it's after a crisis, which many times when someone's going into residential care, rehabilitation, something along those lines that's going to actually trigger a conversation about paying for something, and long-term care insurance comes up. Even individuals that have it sometimes don't understand their policy or recognize what Medicare does and doesn't pay for. And so, many times it's one, acclimating the family and the caregiver as well as the care recipient to nursing home care. Can be a six-figure a year dollar figure, and a little bit less than that perhaps for assisted living, and a little bit less than that or the same for home care. And so long-term care insurance really becomes a conversation about, is this something that's going to work right now? Because many folks have not thought ahead enough to really understand what their needs are.
So, what would you ballpark those costs to be if a person only has Medicare and is seeking nursing home care? What do you think, or what would you ascertain the out-of-pocket cost to be?
Yeah. And so, for a long term, for a permanent or a non-rehab stay. So that's where people get confused, is that when you go to the hospital and rehabilitate with the intention of going back to where you were, Medicare covers that up to a certain amount of days. But when we're talking about an individual that, because of whatever needs to remain at the nursing home specifically, you're talking anywhere from $90,000 to $120,000 a year. And that's really a ballpark depending on where the individual is. Assisted living, which sometimes can be a less intense level of support and need, can be 50,000 to $70,000 a year, and so a pretty significant number. And that's where long-term care insurance can help a family with or a care recipient with those costs.
So, Andrew, let me ask you, with that background, and just knowing that everybody doesn't always have long-term care insurance, can you give us in a brief statement what the major difference is between having long-term care insurance versus your regular health insurance or your Medicare, and how those policies could be structured?
Yeah, well, the biggest difference is the coverage you will not have if you don't have long-term care insurance, if you end up needing long-term nursing home or assisted living care or home health care. One example is dementia, long-term dementia. There may be nothing the hospital can do to get you back on your feet, so to speak. This is just your new normal. And if you constantly need that care, as Marvell said, it could be the difference between paying $120,000 out of pocket or not paying it out of pocket. And the reality is most people, if they're faced with this decision, it often is the difference between them being able to put their family member into the home they need or keeping them at home. And so many of my clients are having to weigh the decision of like, my claim's been denied. I can't even afford to put them in there if I don't get this benefit paid. So, and the reality is there's really no the uniqueness of long-term care is that there is no other way to get insurance coverage for this kind of care. All you can do financially is save up enough money for the what if, and that's like a very 1% kind of luxury to be able to save up enough money for the possibility that a family member ends up or you end up in long-term needing long-term care. So that's the biggest difference.
Oh, thank you so much for that. And I hate to, we don't want it to be such a dire picture because so many of our family caregivers are stepping up and meeting the need, but they're finding out pretty late in the game where their gaps are. So, Andrew, could you also walk us through what that's like, realizing that you don't have enough insurance and what might be the steps? Like, let's say you do have a long-term care policy. What would make you file a claim against it? And more importantly, what might be a challenge to getting that claim approved?
Sure. So the way these policies are set up is that there's very specific triggers as to what entitles you to benefits. There's two main ones. So the first is, can you go back to the prior slide? It's just lay out there. So at the very bottom, you can see there's two main benefit triggers. So the first is the inability to perform two or more activities of daily living. These include bathing, eating, dressing, toileting, transferring in and out of bed, and continence, which is different from toileting. Toileting is the ability to sit down and stand up from the toilet, and continence is the actual ability to manage your bowels, basically, to change out your own diaper or anything like that. So they're two distinct things. If you need assistance with two of those six things, or more, of course, two or more of those six things, that should qualify you for benefits under the policy. The biggest thing that often comes to me, the question that comes to me is, well, I don't need my caregiver to physically do it for me, but they need to be standing right there to make sure I don't fall. What that's called is standby assistance, and that qualifies as an ADL. So if you can physically do the thing, but your caregiver needs to be right next to you to keep you safe, that counts as the inability to do that ADL. So standby assistance is a very important thing to understand. The other separate benefit trigger, so you could be completely physically capable, but if you are separately cognitively impaired, and what these policies usually describe as severe cognitive impairment. What does severe cognitive impairment mean? It usually means that someone cannot be left alone without being a danger to themselves. Now, what exactly does that mean? It's usually a reasonable person standard, but it can vary a lot. There are certain people who you leave them alone for a moment, they might hurt themselves, might walk out into the street. There's some people who are mostly okay, but can't be trusted to take their medication alone because they can't be trusted necessarily to know exactly what to take and when. sometimes that could constitute severe cognitive impairment. If you've got something like Alzheimer's, it's very rare for an insurance company to deny a cognitive impairment claim with a significant diagnosis like Alzheimer's. But a lot of people suffer from dementia that's non-specified. They don't have a formal Alzheimer's diagnosis. So when they try to allege cognitive impairment, sometimes it requires a little bit more evidence than what the doctor has already kind of created. So those
Is
are the two main benefit triggers.
is that so when you talk about the evidence and just the administrative red tape that one would have to go through, is this when it might be helpful for caregivers to understand the types of specialists that their loved ones have been going to, whether or not they need, let's say, documentation from a neurologist
Mhm.
to cement that claim for dementia? Is that what you mean?
That's one excellent point. So if you are trying to if you're dealing with a cognitive impairment claim, one of the first things you'll need, I think at least, is a visit with a neurologist. A primary care doctor, they'll certainly, they'll acknowledge cognitive impairment, they'll acknowledge the dementia, but insurance company will usually demand more evidence than just that. So
Okay.
a neurologist is usually a great first step. Another thing that very often ends up being something we recommend to our clients is called a neuropsychological evaluation. It is not something a neurologist does. It's done by a neuropsychologist. They're a separate specialty, and a neurologist can refer you to a neuropsychologist to have a formal cognitive evaluation done. Um, be warned, sometimes if that evaluation comes back and says mild cognitive impairment, the insurance company will deny the claim until you get another one that says severe or major cognitive impairment. So it's something you can consider, but if you're at that point where you don't know if your loved one needs the care, but you don't know if you've proven it, that's a point where I'd recommend trying to get a free consultation with a long-term care lawyer, because that's what they'll be able to kind of help you with and tell you what kind of issues you're
And
dealing
tell
with.
you where you are.
Yeah.
Well, thank you for that. Marvell, let me ask you, um, let's talk about the caregivers and their role in this long-term care insurance policy saga.
Mhm.
So, in your experience, what role do family caregivers play in the assisted living nursing home space? Is there any role for them to play, or how do they show up in that space?
Yeah, no, they absolutely have a role, and should never have the impression that they don't have a role, because they are advocates, they are chief understander of things, and they really are a partner in shared decision making when it comes to the needs of the person that they are supporting. And so some of the things that really they engage upon is one, sooner rather than later, understanding whatever long-term care insurance policy you might have, understanding the overall financial needs of your loved one and the financial resources that may be there. It could be that your loved one qualifies in your state for Medicaid. That varies widely from state to state, and so it doesn't mean that long-term care insurance isn't something to consider, but it becomes a piece of a larger puzzle. So you're talking about the potential for Medicaid to pay for one aspect of for short-term rehab or Medicare, and then Medicaid as a part of that. So understanding that becomes a caregiver's entree into how to help navigate that system. The other piece of it is, as Andrew mentioned, understanding what triggers the benefits themselves, and being able to have a good understanding of how to navigate that. But caregivers are not just helpers; they are decision makers and advocates. And so when insurance companies and health systems and providers, they all respond differently. And so that's where the navigation comes into play. And one of the things we do at Caregiver Action Network is every day we see caregivers that are informed and getting better outcomes because of being informed and earlier on. And so being able to have those resources and understanding that if you can seek legal guidance to really have your loved one um, um, early on seen as holistic approach so that your options aren't limited, because the longer you take to really delve into some of these issues, kind of your options start to winnow down. And so being able to have that information up front and just making sure that you don't throw good money after bad. And, if you can get a free Lego consultation, do that, get information and gather that and understand that, you really are in a good position when you plan out early.
So we have family caregivers who are just showing up as that. We know that there's been an issue with caregivers self-identifying, that they identify as the role that they play with their loved ones, such as a spouse or a daughter or, a son, a niece, as opposed to caregiver. There are also other roles that are assigned to family caregivers according to the loved one's need, such as power of attorney. Andrew or Marvell, could you speak to how a caregiver holding the title of medical power of attorney or any other type of power of attorney might interact with this long-term care insurance issue?
Yeah, I can speak to that. So it happens all the time where there are people who file claims, claims are denied, have power of attorneys first. The first thing I'll say is that if someone needs a power of attorney, that's probably pretty good evidence that they have some severe cognitive impairment which justifies the care. So the argument, we like to use the argument itself and bring in the information of why the power of attorney was established to explain to the insurance company why that probably supports the claim. The other thing is that power of attorneys and even, basically caregivers and powers of attorney are arguably the most as important to the claim as the claimants. If you have a power of attorney, you'll basically have full access to the claim and the claim process. They'll communicate everything with you the same way to do the claimant, and you'll be involved kind of every step of the way. Um, it's so important for the caregivers to be involved and to understand what's going on for two main reasons. One is that in order to get the benefits paid, the caregiver has to actually document the care. So they have to say what they're doing and when in order to get reimbursed. And that often includes what kind of care they're giving and when. So they need to understand what the policy qualifications are and how to explain that if asked. The other reason is that the caregivers are so often the claimant's best advocate. I'd say when people reach out to us, half the time it's the claimant or a family member. The other half the time it's their caregiver and a non-family caregiver calling on behalf of people asking for help. So I've been able to appreciate how special that relationship is. When people are in need of long-term care and in this position, having that person who's caring for them understand what's going on and be armed about it can really make a massive difference.
Okay. Marvell, do you have any other thoughts behind that?
Yeah, I mean, I think it's also hand in hand with understanding the choices that your loved one may have, and so then along the way having a conversation about healthcare proxy, about the needs and the decisions that your loved one may have, so that because all of that will play into understanding, frankly, the costs of care over several years, or whatever time period that may be necessary for your loved one. So also having that conversation about sometimes nursing home is just not something someone's going to consider. Okay, let's take that into consideration right now. But also, that doesn't mean that family has the means or the loved one has the means to be able to afford to stay at home. Okay, then that means unpaid family caregivers, right? And so, and that really means who within our family, within our extended family, our chosen family, is going to be able to support this loved one, because all of that really is a part of the financing piece of it. It's just that the caregiving part of it for family members is unpaid, but it does have a cost associated with it. So the conversation about what the family members' do's and don'ts and will and won'ts is an important part of it as well.
Thank you for that. So the slide that we have up is just says, what can you do? And I wish the real number one was have a plan, right?
Mhm.
So the current number one says understand your policy. But I think before your policy, you really need to have a plan. I've been monitoring the chat, And, the reality of long-term care insurance is that sometimes people don't discover the need for it until way later in the game of care. And it's particularly challenging, and it makes your empathy grow toward others who just didn't have the information in the right amount of time to make the best, most affordable decision for themselves and their families. So I think having a plan, I think that sometimes caregivers lose sight of the fact that they are giving care to someone, but they themselves might enter into a position of needing care. So when you find information, even if you can't use it for your loved one, make a plan for yourself. Make a plan for yourself that's informed by what you've learned along the way. We also said that you need to understand your policy. To understand your policy, you might want to sit with your legal advisor or your financial planner, someone who can help you make sense of all of the terms and conditions that are housed within the policy to give your claims the very best opportunity to be approved. Finally, well, not finally, caregivers, you should arm yourself with knowledge. So there's all sorts of resources and tools on our website, caregiveraction.org. There might also be resources through your local offices on aging and disability, through your local AAAs, your area agencies on aging that have information accessible to you to use in understanding and navigating these more technical aspects of caregiving. And to Andrew's point, early legal guidance can really help in complex or disputed cases. Find a free consultation, but also don't be afraid to ask for help, right? So we can only access the free consultation if the caregiver themselves knows that it's okay to and welcomed and expected for them to need help with this and for them to ask for help. Next slide, please.
I actually think we uh, skipped a slide. If we can go to the
Oh,
middle slide.
sorry.
No, that's okay. Go
Oh, go
back one
back
more.
to.
Yeah, I think we missed
Oh,
this one.
okay. I
I
apologize.
can just, it's okay. I can just run through it real quick. Someone actually just asked if I have advice when filing a claim, and I can run those two things into one. Um, so first, it's really important to understand your policy. Uh, a few important things. One is that different policies will define skilled nursing facilities differently. Some will require 24-hour on-site nurses, where some facilities don't have someone on staff certain hours and they'll deny the claim because of that. So it's good to understand exactly what the policy requires as far as skilled nursing facilities as well as assisted living. Also important to know what the policy requires regarding caregivers. Some policies require the caregivers to be licensed, some do not. Some policies exclude family members from caregiving. Others do not. That's often one of the most important things, is to buy a policy where your family members who are unlicensed can be paid for the caregiving. That's really important. As far as filing a claim is usually easy. All you have to do is reach out to the insurance company, ask for the claim forms. The most important thing to do is talk to your doctor ahead of time before filing the claim. Make sure they understand how long-term care insurance works. Ask them if they've dealt with it before, and make sure they're ready to fill out what's going to be called a plan of care. A plan of care is a specific legal document that pseudo legal document that you'll get from the insurance company, which shows basically what the plan of care is for the claimant and why they need the care. Your doctor is going to need to be ready to fill this out, provide their own plan of care if they don't want to fill out the form. But it is so important that your doctor is ready to support you, because without the doctor support, none of these claims even get off of the ground. So that's really important. Also important that, as we've said, the caregiver understands, as a caregiver, what the policy says and what the requirements are, because at some point there will be an interview with the claimant as well as an interview with the caregiver. So they'll ask the questions about what care is needed, what you're doing, and they'll ask questions. And I have seen many claims denied because the caregiver gave answers that were honest but not complete. They just didn't, and they didn't frankly understand what they were being asked. They were put in this horrible position being interviewed by an insurance company. It's scary if you don't have the context and money is dependent. It's very scary. So understand what happens for the phone interviews. Now, the most important thing for the claim that may happen is a nurse evaluation. Traditionally, they'd send a nurse to you in person to actually evaluate your home, evaluate what kind of care you're getting, assess your limitations. So now they're doing these remotely sometimes, which I think is actually pretty nice. But basically, if a nurse evaluation is going to happen, make sure your caregiver is aware. And at this point, I strongly recommend getting a free consultation with a lawyer just so you know what the insurance company is like, what their reputation is, how they operate in your state. Some companies in my state of California have excellent reputations where I'd say if you're about to get an evaluation from them and you deserve the benefits, chances are they'll pay the claim. There are others who I would say the opposite, that chances are they're going to deny it, be ready for a fight. And that's just the reality of insurance. So make sure you're aware of these nurse evaluations and how important they are. And the other thing to mention is that once you get the claim paid, they will probably ask for updates every 6 months to 12 months. It is very rare for someone on long-term care to get better and improve at this stage of their life. Sometimes it happens. So make sure that the updates document that the person still needs care, even though some aspects of their treatment is improved.
Now, Andrew, could I ask you to go a little bit more into detail about just looking out for any sort of communication breakdowns that could happen between the facility and the insurers or any of the parties that are part of the claim?
Yes. So facilities, communication with facilities and insureds is extraordinarily important, and it can cause some pretty significant problems if they're not communicating appropriately. And I wish I had better advice for people because it's one of those obstacles that is very hard to overcome. When I encounter a facility that is not communicating properly, for example, and I know my client needs them to communicate better, it's pretty hard to get them to communicate the right way. I've tried. Sometimes you put things in writing to ask them. Sometimes you hop on the phone and you make a request. But what I found is that a lot of the times the facilities don't want to change how they report things because so much of it is now corporate and private equity owned. That there's not an independent decision maker who can make a decision to just help a claimant. They have to run everything up the chain, and the lawyers up these chains are just afraid of liability more than anything else. So my unfortunate feedback is to strongly first assess how these facilities work with insurance companies before you put your loved one there. Make sure they're experienced with it. Make sure they're comfortable with it. If they, if you ask them the question and they say, "What's long-term care insurance?" You might be anxious. If you ask them the question, they say, "Oh yeah, we have lots of experience with this." You're probably in a better position. Um, but the facilities themselves, the one thing I can advise is to make sure the facilities understand what the impact is of what they're doing on your claim. The first time they misreport something, put it in writing to them and say, "Hey, this is a big problem. This is how it's affected my claim, and I'd really like you to fix this. And here's how you can fix it," and see what they say from there. It's hard.
Okay. It sounds like it, but I appreciate the timeliness of the information. My hope is that for our participants, that they can take something from this conversation that they need and apply it to their situation. Marvell, on that point, I just want to pivot back to you regarding that same relationship between facilities and insurers and the various stakeholders to these long-term care insurance claims. Do you have any words of encouragement or guidance, if you will, that could encourage participants to have a better relationship with the facilities or with
Mm,
their care providers?
Yeah, so that's a great question, Amira. So, I come at this from a few different angles, and so I spent most of my career continue to supporting caregivers and older adults. I was a nursing home administrator for many years, and now serving at Caregiver Action Network. But also, I was a caregiver for my mom as a youth, as well as a long distance caregiver for her in her final years. And so that engagement where she lived in the nursing home, where she spent her last couple of years, was important. It's important to know who the players are. And so the number one thing I say to folks is that understand that the social worker there at the nursing home is there as your liaison, your conduit of information, your go-to person for questions. You will get to know other people on the care team. This is the same thing for home care. This is the same thing for assisted living. They may call it something different, but there is always an individual dedicated to being that family liaison and a person that can help you navigate things. And so identifying that person sooner rather than later, and just recognizing that a caregiver in particular, whether it feels like it or not, you know your loved one better than anybody's ever going to know them. So consider it not just you gaining information about what's going on, proactively share information that may make it a better and more effective care environment for your loved one. And so being able to keep those lines of communication open and always know that you can always ask for a care conference, which means it brings the full team together that's caring for your loved one to be able to answer and ask questions you may have. And there's also usually somebody right there in the finance office that can answer questions, help you with applying for Medicaid if that happens, or even just having you understand the finances of the care facility or community better.
Thank you so much. So, this really highlights the importance of our Planning for Care series. These are the types of questions, like I said, on these more technical sides of caregiving that sometimes just are very bewildering to find guidance and a way forward on. And Andrew and Marvell, I really do appreciate your expertise in considering what the implications of long-term care insurance and an overview of the claims process could be. It's always out there that it could be positive, but I appreciate the preparation that this conversation holds for the challenges of the process for the participants that are on the webinar. We've come to a point where some people have been very active in the chat, asking and getting questions answered. I'd just like to again show my appreciation for Marvell as well as Andrew and his team answering questions in real time. I think that's so cool. I would like to just review for everyone CAN's resources. So we are doing this series. We invite you to join us in April for our financial planning matters for family caregivers, and as well as in May for choosing the right long-term care facility for your loved one. No doubt the information that we touched on today will be presented again in a more in-depth format in those two upcoming webinars. We also have financial and legal tools for family caregivers, just an overview, a resource tool that you can use on our website. Next slide, please. We also have our caregiver help desk, and much appreciation to my team who is putting this information in the chat. Our caregiver help desk is a national platform designed to assist caregivers with their immediate and some of their more long-term planning questions to enhance their caregiving experience. So by calling this phone number, the phone number is also housed on our website, as well as a chat that will enable you to get connected with caregiver help desk support. By calling this phone number that you see on your screen, you'll be connected to the help desk and its staff, who will take the time to understand what you're calling about, whether it be about specific, what we call disease specific or therapy specific interactions and interventions for your loved one, or if it's just more general, that a caregiver just needs a voice of support, needs, a lamp to light the path, if you will, because they're looking for information. And we encourage people to ask for help. We want to put ourselves in the position to help those who are asking for help. But our help desk is accessible, and it does provide for follow-up. I am always hailing from my background. I'm always going to also encourage that you seek out your local and regional resources as well for caregivers. And I think those are best accessed in the case of older adults. Just make sure that you're connected to your local office on aging regarding any sort of overview for state and local resources that could be used to enhance you or your loved one's experience at this time. Next slide, please. Next slide. Oh, so we're looking at the chat. There have been some questions in there. Any last thoughts, Marvell actually, can I start with Andrew? Any last thoughts in conclusion for the information that we've shared here today?
Yeah, just a few things to mention. One is that make sure you talk with your loved one, especially if they're getting older, about whether they even have a long-term care policy. I remember a case recently where someone was caring for their mother, and found out years, I mean, 7 or 8 years after they'd been getting care, that they had a long-term care insurance policy the whole time, because they had started to decline before they had the ability to communicate it. So if you're in that position, we were actually able to get the claim backdated 8 years because of California law. So if you happen to encounter a long-term care policy that's old, don't be discouraged, because you can actually file the claims late in many states and get the claims paid. But make sure you talk to your loved ones about whether they may have invested in something like this a long time ago. The other thing is my website's up here. I think if you click through the slides a little bit more, my email address is up there as well. It ends up being intake@cantorlaw.net. Yeah, there it is. If anyone has any questions, please feel free to email me. That's my intake team, because they keep me organized. I can't keep emails organized myself. But I love answering questions. So if anyone has any questions at all, please feel free to email me. And yeah, that's all I've got.
And Marvell, then thank you so much for the information that you provided us, Andrew, from Kantor. Again, we are presenting this more for informational purposes, but there is opportunity for you to connect for information, for support to help you make better decisions. So in that vein, please reach out as needed. And we will also have this information as well embedded where we post the recording of this webinar. So thank you so much for your provision of that information and contact information, Andrew. Marvell, do you have any closing thoughts on what we shared here today?
Sure. So I've seen a lot of questions in the chat of, as we find a lot of times with caregivers, you become in the state where it's like, okay, where do I start? Just give me some starting place. And so thanks to our CAN team for putting links in the chat. If you're curious about just is long-term care insurance something that I can qualify for, or my loved one, or even a younger individual with a chronic illness, you can go to Caregiver Action Network's website, and in the chat, there is a link around long-term care costs, and we have a partnership with a company called Water Lily that can help you navigate that, as well as get quotes for policies if you want. In addition to that, just keep in mind that, it's a journey. And so things are going to change. So, when you get one answer, prepare yourself for 2 to 3 more uncertainties that you may need information on. And so keep coming back to us, and always make sure that you have information at hand. And so really glad for the partnership with Kantor and Kantor, because they really stand as one, a potential advocate for yourself and your loved one, as well as knowing that you have someone that has your best interest in mind, and really making sure that you get the benefits that you need from your policy.
All right. Well, with that, we would like to thank all of our participants today for joining us. Just know that the recording, as well as the slides, will be housed on our website under our Planning for Care seminar series and webinar series. And as I mentioned before, you are invited to participate in all 3 installments. Andrew, thank you so much for the wonderful information and valuable information and insight that you provided today on long-term care insurance. I'm so hopeful that our participants tell someone who tells somebody else that there is help and navigation support available to them as they, figure out what to do and when to do it. More importantly, when to do it for the best benefit of themselves and their loved one. Marvell, as always, thank you for your insight and your expertise just in the caregiver support space. We appreciate you so very much. On the screen as well are the connections to our Caregiver Action Network resources, how to stay connected to us and be in touch with us. Our email address is info@caregiveraction.org. Should you have any follow-up questions, our website is www.caregiveraction.org. You can also find us across socials. My name is Amira Bilal. Thank you so much for joining us. See you next month.